Welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe to my channel and also please give your valuable comments. And you can also go through the playlist. In the playlist I have provided almost all the topics in a very systematic order. So as we know, we were discussing about the dosha analysis in so many classes. So today we will have a unique concept. Again, when we will discuss the doshas, concentration of the dosha is very important in the treatment also. Even when you are selecting the drugs also, okay, the concentration of dosha is important. For example, I will give a simple example which is used in pediatric practice. So most of the time in the pediatric practice we need to write the Medhya drugs, isn't it? Because parents usually complain that my child is not able to concentrate, my child is not able to cope up the things in the class, my child is not able to retain the things. So usually we will go for so many types of major rasayanas. But when we go for the major rasayanas also, we should have some concept related to the doshas. For example, Vata Shamaka Medhya drugs, Pitta Shamaka Medhya drugs and Kapha Shamaka Medhya drugs. Okay. Now for example, a normal healthy people is coming to your OPD, a normal healthy child is coming, or even a old age people are coming, and even a diseased patient is coming, or a very much cachexic patient is coming. Now, which type of Medhya drug actually you will prefer? That is very important. Okay. Now, we have got Vata Shamana Medhya drugs. And if you see what is actually meaning by Vata Shamaka Medhya drugs, the Medhya drugs which are having Madhura Rasa Pradhana, so they are basically called as a Vata Shamaka Medhya drugs. Okay. If you go for the example, see Grita is a Vata Shamaka Medhya drugs. It's also Pitta Hara, but basically it is a Vata predominantly. Then because in the context of Unmada and Apasmara, he very clearly told that for the disorders, the Grita is best for best Medhya, and Grita is best for Graha doshas, Grita is best Kalyana Karaka, etc. He mentioned Charaka. Anyway, so Vata Shamaka drugs like Grita is there. Swarna, it's actually Vata Shamaka. And Kushmanda, Yesti Madhu, having Madhur Rasa, so it's the Vata Shamaka Medhya drug. And Kushmanda, that is also Vata Shamaka Medhya drug. Balamula, Vata Shamaka Medhya drug. And Guruji, they are Vata Shamaka Medhya drug according to, because of their dosha predominance. Okay, so now where actually you prescribe these type of Medhya drugs? So we need to prescribe a Madhura Rasa Pradhana Medhya drugs which is having Vata Shamaka property in case of degenerative disorders of the brain. When the cognition problem is there, mental retardation is there, or any other cognition problem is there because of so many degenerative, Kshaya Janya, degenerative disorders related to the brain, maybe in the nerves, maybe in the autonomic nerves, maybe in the peripheral nerves, the drug of choice is always Vata Shamaka Medhya drug. Similarly, Pitta we have to be considered in the Medhya drugs also. There are so many Medhya drugs which are basically Pitta Hara. Okay, any Medhya drug which is having Tikta Rasa Pradhana, so that is considered as a Pitta Shamaka Medhya drugs. If you go to the examples, for example, Brahmi is a Pitta Shamaka Medhya Kashaya. Similarly, Shankapushpi, similarly, Jatamamsi, similarly, Manduka Parni. So these are basically Tikta Rasa Pradhana drugs, and basically they are Pitta Shamaka Medhya drugs. And their indication is different. Okay, so if it can be given to the normal people or a healthy people in the middle age, whereas Vata Shamaka Medhya drugs preferably it should be given in the old age. Okay, Pitta Shamaka Medhya drugs preferably are the drug of choice in the problem related to cognition in the middle age. So, what actually other problems that where you can prescribe the Pitta Shamaka Medhya drug? For example, metabolic disorders. We have got brain problems because of so many metabolic problems, inborn errors of metabolism or some other metabolic problems. Okay, or the enzymatic activities or chemical reaction related many things, or there may be absence of some of the electrolytes like sodium, calcium, potassium, etc. So, which leads to these particular cognition problems. Okay, that problem may be congenital, that problem may be acquired, which leads to these memory problems or the cognition problem of the brain. So then actually the Pitta Shamaka Medhya drugs are the drug of choice. Similarly, there is one more, it's Kapha. So we have got Medhya drugs which are more dominant in Katu Rasa Pradhana. So any disease of the brain leading to cognition problem or memory problems, okay, or brain functioning problem, where the cause is kapha, then the list of the Medhya drugs will go into differ. So in kapha dominant problems, kapha dominant, that is kapha shamaka medhya drugs, if you see, they're basically katurasa pradhana drugs. For example, vacha. Okay, vacha is there. Any kind of obstruction and all those things. Vacha is there, pippali is there, rudraksha is there, gomutra is there, okay, lashuna is there, and jyotishmati is there. So these are kapha shamaka medhya drugs, and their indication is also different. For example, the cognition problem of the brain is there because of any type of shrotoshangas or shrotorodas in so many speech problems. So there will be some obstruction in the pathway. Okay, so storage disorders, suppose some storage disorders are there. The brain problem is because of the tumors or some other cyst, etc., or dementia, where there is loss of the neurotransmitters, okay, or speech disorders. So here actually kapha pradhana medhya drugs are very, very useful. So this is how we can apply the concept of the doshas while we are prescribing the medhya drugs. So that is medhya drug, when we are writing, it should not be random. In all the cases, we should not use any medhya drugs. It is not like that. We have to look into the dosha dominance. So dosha analysis, this is one of the example where dosha analysis has to be done when you are writing any prescription. I have given simple example of medhya drug which is commonly written in pediatric practice. Thank you very much. In the next class, we will meet with another important class. Till then, goodbye. Please don't forget to subscribe to my channel and also please give your valuable comments. Thank you very much.